Hey class, so I'm going to share a little bit about my research project for NHM 454. So I researched the effects of probiotics on the treatment and prevention of respiratory tract infections. So I learned that RTIs are any infection in the sinus, nose, lung, and throat area. And this can include things like the common cold or even pneumonia, so there's quite the range. I learned that RTIs are super common, especially in kids who may experience the common cold 4 to 6 times a year. And obviously the most well-known route of treatment for these types of infections are antibiotics. And the problem with antibiotics is they can come with consequences such as drug resistance or weakened immune response. One way that scientists have been investigating moving away from antibiotics is through the use of probiotic treatment. I was surprised to learn how beneficial and wide-ranging probiotics can be. I learned that they're generally regarded as safe and they can do more for your body than just help your tummy or your gut. Probiotics can have an effect on the entire immune system. In fact, all of my studies showed significant findings when it came to probiotic treatment and reducing RTI symptoms. It was found that the probiotic treatment can reduce symptoms such as the runny nose, headache, throat ache, but they can also reduce hospital stay, they can reduce the amount of time patients rely on antibiotics, and they can even help reduce the likelihood of future RTIs in more vulnerable patients. I think this research could be neat to apply to COVID-19 cases since we know it can have some lingering symptoms on the body that are yet to be understood. I would also love to see probiotics administered on a more regular basis, even along with antibiotics. I think it could be beneficial to be adding the good bacteria back to your body when you're going through a stressful time like fighting an infection. Anyways, I enjoyed being in class with y'all, and thanks for learning a little bit more about my project.